Hello and welcome. We are live from Galveston, and this is the countdown. Yes, we are on December already, and the countdown starts today. All right,
Yes.
this is a very important meeting that we're having today. In 2021's coming up quick. We're going to be talking about a Medicare deadline that's looming. We're going to be talking about marketing commercials and mail. The end is near and preparing for 2021. And we have a special health tip of the week. Welcome, Vickie Owens. Hi, Vickie.
Hi. I am live here in Galveston, guys. This is
You're
this is
you're in
cool.
Galveston. Where's the beach?
Oh, it's back there.
It's back there.
It's
Okay.
back there. It's a couple of blocks away. So,
Okay.
but
All right.
this is my second Walgreens. I haven't. The other one is actually right on the beach. It's right on the seawall. But this is the one that's on 61st Street in Galveston on the island. So you might hear a lot of stuff in the background because I am in the store live.
That's wonderful.
I hope
And
you
you
guys can
do
hear me.
that to, yeah, we can hear you. So you're doing this because you want to be able to help people with their Medicare questions, correct?
Yes, this is basically we're in the final stretch of AEP, and
Okay.
I've been work doing the Walgreens as well as Walmart. As far I'm here really to help the pharmacists and answer questions for them, as well as helping Medicare beneficiaries um, review their medication in their plans and review the plans overall. So that's why I'm in the stores to really help the pharmacists, but at the
Now
same
that
time,
that is awesome because your name is Star Forward Senior Solutions. And I believe that that is truly what your heart is doing. It's helping the seniors with the information that they need at the time that they need it. So right now it's very important that everybody renew and review their Medicare options,
that's
correct?
very good, Marion. I like that. Renew and review. That's pretty good.
There you go.
But
Because
yes,
things
it's
change, right? They have different rules and regulations, and the medications, the different things are going on, so you have to review it.
yes, it's really the time period that Medicare provides to their beneficiaries to review their plans and to make sure that medications that are, the cost of the medications in the plan they're in right now remain the same. When they go into the new year, because formularies, the plan formularies change year to year, and you want to make sure that you don't run into a situation where your medication goes up and you weren't aware of it. So that's the biggest thing for AEP and making sure that you're ready to go into 2021 with the knowledge that pretty much you're not going to go to the poorhouse because you didn't basically look up your medication at the timely manner. And we have exactly 6 days from today. So December 7th at midnight, it's all over. Okay, so it is round the corner. It's around the corner. You have 6 days to make a change, to review. Many people wait to the last minute, because I have some clients like that. People wait to the last minute to
We
do it.
won't name them by name, but we know who
I
you are.
won't say them by name, but
Procrastinators.
yes. So, but as long as you get it done, that's the important thing. As long as you get it done before the 7th, but
So
have
tell us
have
what
have
is
some pity
involved in
on.
getting it done, Vickie.
Well,
What
actually,
does that
it's
mean to get
people
it
like
done?
myself. It's getting it done means having somebody review your plan, making sure that you are in the right plan for 2021. So if you have to change your plan, it all has to be submitted to the insurance company before midnight, December the 7th. So uh, if you have an agent, if that person is responsible for getting that change into the insurance company by midnight, December 7th, or 11:59, I should say, 11:59, December 7th. So
Okay, so
have
when you
pity
say
on
insurance company, do you mean Medicare or is that something
no
else?
insurance company. Any all the plans, your prescription drug plans are all done through an insurance company. Your Medicare Advantage
Okay.
plans are all done through an insurance company. If you have original Medicare, then you have a, and that's all you have. You should also have a prescription drug plan, which is all through an insurance company. Okay, and so
Gotcha.
that's
It's
who I
separate
talk.
from the government. It's individual insurance, and that's where you step in and help people decide which one is best for them and
Correct.
review the ones that they already have to make sure it's still the best.
Yes. 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 Yes.
Okay. It's
Yes.
starting to make sense now.
Well, for those who are not, who are not Medicare beneficiary, it might sound be a little Greek, but get prepared because it's definitely going to be coming around the corner. I have met in the store today. I've actually met two uh, newbies to the Medicare world, but they were very happy. They were just like excited. Like I just turned 65. So this is all new to them, and I gave them a little, overview of what's to come, but that it was interesting. I had two of them walk in and like, oh, I just turned 65, last month, and so this is their first experience with all the hoopla, so to speak, during this time, so. It was pretty. That was pretty fun. I wish them a happy birthday and congratulations. You've joined the club because both of them said the same thing. They said, "Felt like I just joined a new club." I said, "Yeah, it's kind of sort of like that." You're in the club now. So, but they both were excited about it, so that's cool. I do have a brochure that says, "Turning 65, it's an adventure." So they fell right in line with that. This is an adventure. It's an adventure. But
Well,
um,
they do prepare us ahead of time. I'm 62 and I'm already starting to get mail that says, hey, give us your phone number and your email and we'll keep you updated on all the Medicare changes. And I'm like,
yeah, 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 yeah.
I'm
Right.
62. I mean, what's up with that? It's like AARP gave me a
That's to get you
membership
on that.
when I was
Yeah.
50.
Well, the ARP is different from this whole thing because ARP they cater to anyone that's 50 or above, So that's their market target market 50 or above because I'm an ARP member too, but and I've been there since whenever I was eligible. When I remember when I got my ARP card, I thought, oh, I've joined somebody's club. At the time, I was like, this is something. It was like that's when I realized, okay, you're getting older.
Yeah.
But when you said that about the things that you get in the mail or whatever, so all the mail that you've been getting about AEP, annual enrollment period, and the commercials, and talking about all the, you know, all-in-one plans and things like that on the major networks, that's going to cease. It will stop. You won't get any more. So after December 7th, that all will be done. So you'll be relieved that you won't get those type of things. You won't
Yes.
get the advertisements of all the different Medicare Advantage plans from all the different insurance companies. Now, if
Yes.
you are a newbie, you will. In other words, if you're just turning 65, 6 months out to turning 65, then you will continue receiving mail. You will continue receiving mail about, turning 65, targeting different, plans and things like that. You'll get phone calls, because when you're turning 65, it's something that, you need to, take care of. But there are people out there like myself that will help you because we know that you're going to need somebody to enroll you and make sure you're doing, going down the right path. But it's public record when you turn 65. It's public record, so everybody.
Well, every time I turn on the television, I don't watch traditional television, but I
Mm-hmm.
have to turn it on in order to get to Netflix.
Yeah.
And so every single time I see a commercial, free Medicare, free dental, free vision, free no co-payments, and it makes it all sound so enticing.
Well, unfortunately, there are limits to what they can and cannot say, but they take it to the very, limit line, so to speak. And, it's marketing. So they're going to basically give you all the information that's, close to the truth as much as they possibly can. But there's a lot of information that they generalize. And so, unless you are within, you understand that all plans are not created equal. So, and everybody's not created equal. So a lot of the marketing, I hear in those commercials, I hear them too. I listen to them too. Some of the information is kind of stretching to, a limit of being valid, so to speak. I would just say it like that. Uh, Not saying that they're giving you false information. It's just that a lot of the information is not true for every plan. So they kind
Right.
of generalize a lot of things. And when you're generalizing things, that you give, sometimes you can give false hope, so to speak, to people who are looking for certain things. But they want you to get, what they want you to do is call that number so you can get that information. So and you can, it's like they'll tell you, but not everybody qualifies for all that, So um, you just have to call to find out if you qualify. So like I said, they just put it out, generally, but not everybody qualifies for certain benefits that they're saying that they can get. The all-in-one plans that you hear them advertising about, that's a Medicare Advantage plan. Because it's inclusive or of parts A, B, and D. And it also has many of them have other extra benefits like vision and dental and things like that. I'm sounding like the commercial, but you know, but that's how. I mean, that's a Medicare Advantage plan, though. That's basically what that is. When you hear
Okay.
all in one, and thing is that people get confused because they're not really sure what they're talking about. But
Yeah.
it's marketing. That's how they basically structured the uh, commercials to get you to think, oh, they said all in one, but basically all in one means it's a Medicare. They're talking about a Medicare Advantage plans because they are all in one. They have the parts A and B, and a lot of them have D. Not all of them, but a lot of them have D. So it is all in one, plus extras, other bennies that you can get within a plan, and they pretty or generic, so when you call in to the numbers they list, it's going to be a listing of there will be agents on the other end to assist you, so you're calling in and you're going to talk to a Medicare consultant or insurance agent to help you enroll into the plan that that's going to be best for you. So that's what those things are about. But I do the
Vickie,
same thing.
tell me who is a good candidate to call you and get the most out of the Medicare system? What type of person? How old are they? Do they have to have illness? So tell me who is
No.
the person that should call you.
Well, anyone who is Medicare eligible, and what that means is that you are at least 65, or you're about to turn 65, or you have been on disability for 24 months, and those are the people that I help in the Medicare arena. Anyone over 65, turning 65, or if you've been on disability for 2 years or more, because you are considered a Medicare beneficiary, and that's who that's one sector of the market I do help. I mean, that's not the only sector, but that's one sector of the market I do help in the health arena. So
Right. But for right now, the deadline being December 7th, the people that should call you right now today.
are people who are basically Medicare beneficiaries.
Okay.
Medicare beneficiaries should call me, or
Okay.
seek out my assistance, or someone's assistance to get this done before December 7th. That's the big thing, is to get it done before
Okay.
December 7th.
All right.
Um,
So if you're listening to the podcast, Today's date is the 1st of December, and we have until midnight on the 7th, but please don't wait that long. I want you to write this phone number down. Pull over if you have to, if you're driving the car, and make sure you write this phone number down. It's 713-444 3269, because Vickie can make an appointment with you to talk on Zoom, which is an online system where you can see her. Or if you don't have a computer and you just have a phone, that's fine. She'll call you, or you can call her, and you can set up an appointment on the phone. Now, here's the big thing for me. Think about who you should share Vickie with, okay? Do you have a neighbor? Do you have a friend? Do you have a loved one, a family member, somebody that you know that has Medicare, who is not taking care of it? They're not looking ahead. They're not doing anything about it. They're just procrastinating. That's the person you need to call Vickie and give them their phone number
Yeah.
and have Vickie call them, because let's face it, we all know somebody who's not taking care of themselves. And this is one way that you can help them take care of themselves, because they need to check their prescriptions. They need to make sure they have the right plan. They have to change it if they don't have the right plan. And you only have until the 7th for the whole year of 2021.
And
So,
the other sector is also those people who are on Medicare supplements, who have a Part D plan. If you were interested in enrolling in a Medicare Advantage plan, and that's something that you thought about over time, this is the only time of year you can actually do that as well, unless you do a special enrollment period, which is, has some, like if you're moving or some type of significant thing in your life, uh, that will grant you a special enrollment period. But if you don't have anything like that, um, then those who are think were have thought about Medicare Advantage plans and who are on supplements, or if you're just on Medicare Parts A and B, you don't have anything else, this is the time to enroll in a Medicare Advantage plan, because you won't have the opportunity again if you have already been on Medicare for a while. So this is the time to do those type of things as well. So anyone who is considering getting more benefits than you have with just Medicare by itself, this is the time to enroll in a Medicare Advantage plan. So, and those who are
okay.
on supplements who are happy to stay where they are, you still need to review your Part D
There
plan.
you go.
You're
You got to
making,
review it,
you
because
still
they
have to
change
review.
the rules. They change.
Yeah,
The insurance companies are flipping and flopping and doing all kinds of crazy things.
yeah,
We don't know
yeah,
what they're doing, but they're doing it, aren't they?
yeah. Well, I mean, like I said, most times they try to tweak their plans to make them better.
Yeah.
So they're trying to, you know, uh, I guess, like I said, tweak or edit their plans, their formularies or whatever to make them better. And a lot of times they are better. But the thing is that if you're in a plan and you haven't looked to see if the medication you're taking is going to be better, better priced in the plan that you're in, then you need to basically review and make a change or whatever. Because sometimes it just happens. Like insulin in one plan may be $90, $95, and then in another plan it's 120. So you just don't know. It really depends on what plan. It's not. It has nothing to do with the um, farm. A lot of people think it's the pharmacy that you can basically um, go to different pharmacies and get a different price. You can, but it's not, the price is not going to change that significantly when it comes to Medicare. Majority of the time, it's the plan that you're in that's going to dictate how much you're paying for that medication. If you're a
Okay.
Medicare
That
beneficiary,
makes sense. Yes.
yeah. So,
So is
but
that what you're talking about when you say to prepare for 2021? Is it just going reviewing what you have now?
no, sorry. But no, I actually preparing for 2021. Okay, that's the next step after the deadline, is really getting ready for 2021. So the things that you should do here are a few things that you should do become January, well, 2nd, 2021. You should make an appointment with your doctor. You basically want to have a baseline of the. Some plans actually will uh, grant you or send you a gift card just so you go and see your doctor at the within the first 60 days of the new year. So you want to make an appointment, see your doctor. You want to do all your screenings, and all those type of things. Get a wellness check. You know, first
Okay.
thing first thing for 2021. The
Okay.
and that will include a lot of the screenings. Sorry, that will include a lot of the screenings, such as diabetic screenings, your, what is it, mammograms, things like that. So you want to go through that, and you want to ask for a physical. You don't want to just say I need a checkup for it, whatever, because there's a difference between a physical and a wellness check. A wellness check, the doctor is just basically reviewing your medication, taking your blood pressure and blood tests and things like that. You really want to get a physical, at one, because that's the only time of the year that you really should get a physical, so you have a baseline to know where you are as far as your health is concerned. Okay, so that's that's like the first thing you do when it comes to 2021. The other thing is kind of basically go through your plan, verify that you understand your plan and what your costs are going to be within your plan. When you make an appointment with your primary care doctor, also make an appointment with some of your specialists, so to verify that they are still in the plan. That,
Oh, okay.
yeah,
Okay.
exactly.
They drop out sometimes.
Sometimes
Okay.
they will drop out, exactly. So sometimes they will drop out.
Wow.
So you want to make appointments with your specialists, uh, doctors as well, to make sure they're still in the plan. That appointment could be a month or two out, but at least making an appointment to see them, and making sure that the plan is functioning. It is what you signed up for it to be. So you want to verify that. You also want to make sure, really, before 2021, you want to make sure you have your health cards. In other words, for every company, you want to make sure you have the latest and greatest card that you have, that they should send you an updated card for the year 2021. Okay, uh, check and verify that your primary care um, physician, if you're on an HMO, is listed on the card, and that's the one you signed up for. You don't want to have any surprises for that either. So you want to make sure you get that card, look at it, review it, and make sure everything on it is correct. You know, and if there's anything that you need from your insurance company, there's an 800 number that's basically for member services. So you need to have all that at your on the card and in your wallet. When you go. And
Okay.
the other thing, if you change your plan, you want to make sure your doctors know you changed your plan. So you want to call them and possibly give them the updated information. So that's the really good thing about making an appointment with your primary care doctor. At the same time, they should ask you, has anything changed with your insurance? And so to kind of prevent all the administrative situation when you get to the doctor's office, do it prior to. Just let them know that you do have a new insurance company that's taking care of your health care. Okay.
Okay. All right. That makes sense.
Yeah, yeah. But those are the pretty much the things to do come 2021. It's basically making the appointments, checking to verify your doctors are in the plan, making sure you understand your plan. In other words, go back through it so you know what you should be paying for certain things, because that's one big thing I learned, that beneficiaries get a plan and they have a situation, or some type of something happens, whether it's going to have to go to the ER, be in the hospital, or whatever, and because they don't know, they haven't checked their or reviewed their plan, they get billed for things that they should, are not the right cost. That's what I'm trying to say, not the right cost. So, that you want to review your plan and know your plan. The other thing you want to do is really know, not when you, as far as knowing your plan, knowing who your insurance company is that you signed up with. That sounds strange. It does. However, there does not come a day when I ask someone, especially since I've been doing AEP, as I ask someone, well, what plan are you in? And they look at me with this blank look like,
Like I'm in a plan.
I'm in a plan. It's
You
like,
didn't
well,
tell
what,
me I was in a plan.
you know,
Yes, I
I'm,
did.
I think I have, and I'm, I just smile and I said, well, you have a supplement or do you have a Medicare Advantage plan? Do you know? Kind of, review your plan and kind of try to remember, what type of plan you have, because a lot of people get signed up on stuff and they have people that really, they're not really explaining things to you. You just know that you're covered, and that's important, but you still need to know who is your insurance company, because in an emergency, you know, you really need to be able to, relay
Isn't that
to.
interesting? Because somebody asked me what my blood type was the other day, and I had to say to myself, well, I think, but I'm not really sure. So, what you're saying is you should have all this information in a form, maybe on your computer or printed out somewhere where you can access it, all the information about your health that you can get to right away. Your health insurance, Vickie's number, your blood type, and your next of kin, and all the stuff that you think is important. All your drugs that you're taking. Um, you
Yeah, I mean,
know,
it's a very good idea if
yeah,
to get organized for
yeah,
2021. Is that
yes.
you
Thank
should
you.
have, most people, especially if you have a lot of medication. Most people have a list, of their medication,
Yeah,
because and it's easy to get, and you go to your primary care doctor, have it printed out and give you a copy. It's so easy, or go to your pharmacy. They'll print out the copy
I
of
was
your
wondering if
medication.
the pharmacist would do it. Well,
Yeah.
since we only have about 3 minutes left, I know that you have a health tip for us, and so we would love to know what that is.
Okay, this is my health tip going into 2021,
Thank you.
because I'm
I'm
really I'm
ready.
really focusing
I'm
on that,
ready.
and it's not just, uh, because when it comes down to it, it starts here and here. Where I'm pointing to my heart, it starts here, but you have to. This is addressing going into 2021 with thankfulness, as well as not being stressed out and things like that. pick
Hmm.
pick a time of the day. This is my health tip. Pick a time of the day that you can sit alone for 15 minutes. And you can, if you have a journal, you get a journal, or some type of little notebook or whatever, that you can basically write out you want to meditate for a little bit, write out your thoughts. What you're grateful for. One, that's one thing to do. What you're grateful for. Um, what you want to achieve in that day, you know, and as well as who do you want to reach out to and basically bless them, okay? But you want to have some time during the day going forward, because being healthy is not just physical; it's also mental. And so
Yes,
if you're not healthy on a mental level, then
yes.
you can't get healthy. You really can't get an overall 100% healthy. So my health tip for everyone is to take 15 minutes out of the day and um, pretty much just kind of like meditate, compress, you know. And I know a lot of seniors basically, are relaxed and are not working or whatever, but there are still some seniors out there working, and there are still seniors out there who are, might be stressed out because of family situations, like they're worried about their kids or they're worried about their grandkids, and things like that. And then
Or
there's seniors.
viruses. They're stressed out about,
Yeah,
yeah.
yeah, and the thing is, also, you could be in a situation where you're, um, financially, well, seniors are on a, fixed budget. Most seniors are on a fixed budget, so you might be worrying about many, many, many things. So everyone, not should take 15 minutes out of the day to decompress, reflect, and be thankful for something that has happened to them, whether it be the
Thank you.
last 24 hours or the
I'm
last week
thankful
or
for
whatever.
you, Vickie. I am really thankful for you, and I know that everyone that you touch is thankful for you as well. And
Well,
I want to thank you, audience, for being here with us today. We were live from Galveston. Thank you very much, Vickie, for turning your pad on and tuning in and allowing us to know that you have us covered. I
I,
appreciate you.
I got you covered. I got you covered. That's what I
So
do.
you're the person I'm thankful for today.
Well, you are the person I'm thankful for today too, for being
Excellent.
there for me, doing this for me. I really appreciate you, and I really appreciate basically anyone who has been in my life that has basically made my life better. Those people I'm thankful for and I
Mm.
appreciate.
Yes. Yes.
So I hope that everyone out there takes care of themselves and think about what I said about being thankful.
I
I have a
appreciate
little.
that. And I love your tip.
Okay, cool.
Hmm.
All right
Yeah.
then.
We'll see you again next week. We'll be back on Tuesday, and we will make sure that you call Vickie. I'm going to give your phone number one more time before we say goodbye, because it's very important that you call her if you haven't already. All right, you ready? It is 713-444-3269. All right, bye for now.
All right.
Bye, Vickie. Drive safe
Bye
back
everyone.
home.